I know that all of us have gotten hundreds of emails with regards to what will happen with Sendero.
I was here last year and I'm here today because I am very concerned about the thousands and thousands of people that are going to lose health care coverage.
I am about a year out from being diagnosed with very aggressive, fast-growing cancer, non-Hodgkin's lymphoma, diffuse B-cell. And if I had not been insured, I wouldn't be here today. I truly believe that.
That means that this year, 3.5% of Travis County's entire population, that's 1 in every 28 people, will lose their insurance or see premiums increase.
You can't just drop folks.
Excuse me. In February, you had sepsis.
Healthcare is a human right. Yes.
If you don't have access to healthcare and you have a chronic healthcare condition, you can decline pretty seriously. If somebody calls Adult Protective Services on you, you could be in danger of being institutionalized.
But it concerns me that you don't have your time to do your due diligence.
This has not been last minute. This has been long debated. So I'd like for him to respond to the timeline.
But from the public's perspective, it's last minute to us. I mean, this is the first I've heard of this. The immediacy of the decision and the impact it's going to have, that's, I think, the part that hasn't really been vetted publicly.
This is like an experiment. A lot of this is about experimenting on people who have very little money and access to resources. And I don't know why you're okay with that.
But options for what? What are the options? That is my question. Do you have a plan for those options?
There's been discussion about whether there are alternatives and about the total of 4 providers on the Obamacare exchanges. 2 of them are Ambetter and Blue Cross. If I go to those, that will cost my family of 3 approximately $10,000 extra per year out of pocket.
You know, it's easy to say, oh, there's cheaper alternatives or there's other alternatives available, but as soon as you get to the fine print, you realize what a difference a community plan makes. We do have one of the broadest networks.
There was mention of a potential lower cost plan. That's an oblique reference to Oscar. The Oscar plan is lower cost. They have incredibly tiny network across the board.
Most of them, they're having trouble for insurance. The ones that do have Sendero, they have been very privileged.
I can say what an amazing healthcare plan Sendero was and how it really gave our family options to help her deal with this, devastating surprise last November.
They're doing the right thing. They're providing something of great value.
Sendero was expansive and easy to use and helpful and really saved her and our family from the financial devastation. I mean, beyond the devastation of our beloved sibling having cancer.
Hadn't been insured for years and years, and then when the marketplace became available, and through the Assistance for Essential Health, I've been insured, and I'm here today because of it.
These 42,000 folks are arguably the most vulnerable residents of our county. This includes 1,000 musicians and folks in the Eastern Crescent and Del Valley who have been waiting over 14 years for a full-time clinic or a single grocery store.
We appreciate you coming.
Okay, the last point then, you mentioned is something like a nuclear option for you to turn this down. If it's a nuclear option, so be it, because it's better than coming back next year, counting the medical bankruptcies and counting the premature deaths.
We were always always for that because we understand that people have got to have insurance.
Thank you. I'd like to continue to be here. I have a son who's 6 years old. He needs me here. I have continuing care that I need to be able to afford for years to come.
I respectfully ask you, Commissioners Court Judge, to delay voting on our budget, or if you have to pull the nuclear option, pull the nuclear option, so that our board can reconsider our vote. More than 24,000 Travis County residents are affected by this vote, and it requires mindful deliberation that I think we should revisit. And you've heard today, people's lives are truly at stake with this decision. Thank you for your service, and thank you for consideration.